So first of all, I'd like to just say thank you, Thomas. I'm sorry Kevin couldn't be here, but we have you, so that's a good thing. Welcome to our meeting. I first want to introduce a couple of people because they are not speakers today, but they did have a very important role in coordinating everybody who will be speaking. So I want to give them a shout out. We have David Loud from PSARA, also one of the co-chairs of HCHR. The other co-chair, Nathan Rodkey, represents Washington Community Action Network. And Margaret Carey is with Working Families Party and also Seattle Indivisible. The three of them, I really give them kudos for pulling this meeting together. Most of the other people who are on this call today are speakers of short stories, and they will be introducing themselves as they begin their part of the speaking engagement. I do want to first give out Thomas a message from Mr. Paul Benz of Faith Action Network, which is a statewide organization. He just wanted you to know that he and FAN stand in solidarity with HCHR, even though he couldn't be here. So, are you ready for the festivities, Thomas?
Let's have at it. I'm glad I can be here. And I guess just by way of introduction, my name's Thomas Eagen. I'm Senator Cantwell's health policy legislative assistant. So I cover kind of all things health related in the office. And my background is in primarily in aging and disability. I did my PhD at the University of Washington in rehabilitation science, and then also did a master's in public health and health systems and policy. Looking forward to hearing from you all and hearing all of your stories.
Sounds like you're an all-around guy, you know. Okay, so I want to tell you just a little background about HCHR. Healthcare is a Human Right is a statewide community and labor campaign to make healthcare a right to all people in our state and in our country. We're part of a growing movement for healthcare justice. We believe the fundamentals of our health system must be built around delivering healthcare to everyone in our country in an equitable way. We want healthcare for people, not profits. Because frankly, how do you put a dollar bill on somebody's life? I have never been able to figure out an answer for that. We're here to talk about transforming the system so that it will meet the unique needs and health risks of every human being with no barriers to entry. It would mean comprehensive and guaranteed access for all people with no financial barriers and accountability to patients with enough staffing to transparently meet community needs. The need for healthcare justice is greater than ever. The pandemic has laid bare how much our health is interconnected with each other. How access to healthcare is shamefully unequal, depending on your race, occupation, where you live, and other reasons that should not apply. The laws of our state and country fail to set up accountability to guarantee universal and equitable access to healthcare. That's a problem for me too. I like accountability. So we must ask, why not? We would also like an answer to that why not question from the senator herself, if possible. And we want to talk about what can we do to fix this in 2021. We in HCHR believe that the most effective and economical solution is a universal public health plan publicly funded and administered. In other words, expanded and improved Medicare for all, right? If Congress fails to take this step now, states like ours and several others are getting ready to achieve universal public plans, but we still need more federal help to do so. That's why we are also supporting Representative Rokana's state-based universal health care, which is soon to be introduced, I see. We anticipate there will be a Senate companion bill, and we will want Senator Cantwell to support that bill. So I'm gonna share a little bit, just a little bit of my story, but before I do that, did you have anything you just wanna touch on about what I just said about our overall, Thomas?
No, that all sounds
Okay.
good. And I would say that the senator has been a supporter of ensuring that there are different options and availability for people to get access to the needed healthcare that's available. I think her position has really been that the what was expanded in the Affordable Care Act, specifically within the basic health plan that is currently operated out of Minnesota and New York, which was started in Washington. That was a plan that was largely funded by the federal government and really hit at those that were struggling to access. So I think moving forward, as we start to look at restructuring and looking to see what are the best options, that she will want to ensure that there's science backing the option and looking at what's the best thing that's available. So I'm looking forward to hearing your stories.
Wonderful. So I'm going to share a little bit of mine, like I said, but I do want to say we have quite a lineup of speakers. So what I'm going to do is break it into groups. After a few speakers, I will ask you if you have any questions or concerns about what you heard from the couple of speakers up to that point, and then we'll move on to the other speakers if you don't, okay? So I think that my story has been really well noted because it was the story that was highlighted in the ACA and leading up to the ACA signing. Marcellus Owens, who was standing with President Obama, is my grandson. It was my daughter's story that was told in that fight. But there was one thing that still today does not sit well with me, and that is the fact that her story was noted that she was uninsured. And although that's correct, the piece of it that disturbs me is that she was not uninsured until she lost her job. When she lost her job because of being too sick to fulfill her job, she lost her employer-based healthcare with it. It concerned me because when I tried to get her Medicaid to continue seeing her doctors, I really hoped that that would prolong her life. But because she worked for a prior year, she did not qualify for a state-based Medicaid. So she could not see the doctors. She lost her life. For me, there's a flaw in the system, and I have been battling since then to try and find a way that people could be qualified for Medicaid in extenuating circumstances, like my daughters. There are thousands of people in Washington and millions across the country who are losing healthcare because they're losing their jobs right now in the pandemic. So it's really critical at this moment that that point is addressed. For me, the way that we should look at possibly fixing it is totally detaching healthcare from employment. if we do that and make healthcare a standalone entity, because really that's what it is. It's a fundamental basic necessity. So it should stand alone. So I would love for people to get on the conversation about detaching our healthcare. So that is my story and my daughter's piece. I'm going to go to the next person who I believe is Steve Garey. Is Steve on the call?
I am.
All right, Steve, you're up.
Thank you so much. I would like to thank the Senator and our staff for allowing us to tell you about this issue that affects us all so much, as well as everyone else I'd like to thank on the call. I want to tell you a story about this past year, which has been a year of tears for my family, particularly on my wife's side of the family. I want to tell about a particular loss. And so I'll go back to March, about exactly a year ago, as the virus was beginning to shut things down. My wife and her twin sister were both approaching their 65th birthday. And while this was kind of a procedural thing for my wife to get on Medicare, her twin sister's opportunity to get on Medicare and have a supplement, which would make medical care affordable for her, was like coming into the promised land. Her twin had lived most of her life as a low-income person, as a single mother, and she had rarely had insurance or the ability to see medical providers without fear of the cost. And she had actually learned or tried to prevent seeing doctors. She had tried to avoid that. And because every time she had to see someone for herself or her son, it would bankrupt her. She couldn't pay her rent. She couldn't fix her car. She couldn't buy groceries. Well, leading up to her birthday in March, and the hope that that provided, she hadn't been feeling very well. And shortly before her 65th birthday, she was forced to go to a medical provider at the emergency room, and she found that she had melanoma, advanced skin cancer. It was fully metastasized. It was everywhere in her body, and really nothing could be done at that point. But to come home to our house as a hospice patient, she passed away in May. That was just a terrible blow for our family, because we understood how preventable it might have been. And while we might not know what could have been, we're convinced that if she had felt comfortable seeking effective medical care, this disease would have been caught sooner. She would have had a much different outcome. And we think we're just one of millions and millions of families and people who've lost loved ones unnecessarily because they couldn't get affordable and effective medical treatment. I have little in common with those who want to talk about making America great, but I'll tell you what, I don't think America will be great until we can provide effective and affordable medical care for every single person. Thank you so much for listening.
Steve. David McLanahan, a quick introduction of yourself and your story, please.
Hi, I'm a retired surgeon with 38 years experience treating the underserved. I support Medicare for all because I believe that everyone should be able to go to bed at night without worrying about a health problem could destroy their well-being, their financial security, and their family's future. During my career, I was lucky to have worked in institutions with a mission to provide for people who don't have adequate access to healthcare. For 25 years at Seattle Pacific Medical Center, they allowed me to set up and staff weekly half-day surgery sessions and 2 safety net community clinics, Country Doctor and International District Community Health Clinic. During that time, I helped care for thousands of people who couldn't afford tests or medications, and who put off seeking care for financial reasons until their condition became disabling or emergency developed. Give one example. A 45-year-old employed truck driver with a family, but without insurance, came to the Swedish hospital emergency room because of a gangrenous gallbladder requiring emergency surgery. He had hypertension diagnosed a couple of years before at a community clinic, but couldn't afford the medication and never really had his blood pressure controlled. During the operation, his pressure shot sky high and he had a stroke that left him partially disabled. This kind of personal and family disaster is very unlikely to occur in Europe or in Canada and we don't want it ever to happen again in Washington State. So I urge Senator Cantwell to express her support for improved Medicare for all, even if she thinks it may not be possible to achieve in the next 2 or 3 years. I'm sure the great majority of her constituents will thank her for this support. Thank you.
Thank you, David. Cheryl Wape, are you on the line? Quick introduction and your.
Okay, my name is Cheril I am an educator. I've taught at Chief Flesh Schools for over 30 years, retired for a short time, but came back. And I'd like to share just one of the medical stories that happens within my family. My daughter was diagnosed about 10 years ago with MS. And wouldn't you know that about 5 years later, my son-in-law was diagnosed with possibly leukodystrophy, which is a brain disease. It's degenerative and there's no cure for it. This has put both of them, and they used to be very good wage earners when their children were smaller. But this put them on a limited income of disability, and they still have one child at home that will be going off to college in the fall. But a significant amount of their income, their small income, goes toward health care, insurance, and out-of-pocket expenses. And it limits their ability to live month to month in a comfortable lifestyle without some types of support from family members, which we're all very happy to do. And when Chris goes off to college, they're going to lose another $500 off of their already limited income. But that's not going to affect the healthcare costs that they both have, which requires them both to go up to Seattle, to Seattle University for healthcare treatments and things like that. And just so much money out of pocket for them that if they didn't have to pay those high costs, their monthly insurance and their medications and their out-of-pocket costs for those things, they could live in a more comfortable lifestyle. We need this healthcare bill to pass, and thank you, Thomas, for doing the work that you do, and Senator Cantwell. And I pray that something will happen that not just that helps my family, but everybody that suffers because of healthcare costs.
Thank you, Cheryl. Sarah Stewart.
So my name is Sarah Stewart. I'm with the Washington Community Action Network, and I'll try and get through this quickly. In the past couple decades, I've run the gamut of uninsured, underinsured with a high deductible, insured but wouldn't cover often common medications, diagnoses, or procedures. I've been on COBRA. I couldn't afford COBRA. And even when I supposedly had good, stable coverage, I still had to declare bankruptcy in the summer of 2005 after being diagnosed with a chronic degenerative disease 2 years prior. To make matters worse, at diagnoses, my rheumatologist stressed how I needed to stop working and apply for disability, but there was no way I could wait a year of no income to get on SSDI, and I desperately needed the health insurance coverage. Instead, I continued to work and made myself so sick, I had to move back to Massachusetts for 9 months shortly after I declared bankruptcy. This roller coaster takes a huge toll, not just financially, but physically, mentally, and emotionally as well. It also impacts families, and the financial reverberations of my illness caused a rift in my family, which still exists to this day, especially since I was evicted into homelessness in March of 2018. It would cost our country less overall in the long run in so many ways, and we would be a more productive society if people could get the medical care, prescriptions, and mental health support they needed when they needed it. Plus, it's simply the ethically and morally right thing to do. Thank you for taking the time to listen.
Thank you, Sarah. So that's the first group of our speakers, Thomas. Did any of them stand out? Do you have any questions for any one of the speakers before we move on to the next group?
No specific questions on my end. Thank you for taking the time to share and tell your story. And it's always really helpful to hear from folks on the ground who are really living out the policies every day. So thank you for sharing.
Okay. Next group, we have Lika Smith. Are you on the line?
Hi, I am. I'm sorry. I was not prepared because my dog is having an incident, so I apologize. But Thomas, I'm Lika Smith with the Pacific Islander Health Board, and I just wanted to ask Senator Cantwell to support Medicare for All because in my community, I'm the Pacific Islander community, it seems like our healthcare is funded by GoFundMe or plate sales, and we can't have that. We have to level the playing field. And with the pandemic, inequities in our communities really stood out. So leveling the playing field would get everybody an even chance. And also, if the federal government would be able to support mental health, then we could have community members accessing the mental health that they need, which has been blatantly obvious with this pandemic. So thank you.
Thank you, Lika. Mohamad, Shidane.
Okay, thank you very much. My name is Mohamad Shidane. I'm the Deputy Director of Somali Health Board. Through our pop-up vaccine clinics in the month of March alone, we have vaccinated over 2,200 Washingtonians, 87% of whom were people of color. We recognize how important the vaccine being free for all has on our success in serving those who are otherwise labeled as hard to reach. We also know that there's a huge need for national healthcare program and federal support for universal healthcare at the state level. Thank you for listening.
Thank you, Mohamad. Next up, Lisa Dekker.
Hi, my name is Lisa Dekker. I'm a longtime supporter of universal healthcare. I'm a board member of PSARA, and I'm on the steering committee of our local indivisible SQUIM. I live in Clallam County on the Olympic Peninsula. So I'm sure that both Thomas and the senator are very, very aware about the disparities in the actual health of our minority populations as compared to the rest of our population. And I know Lika just mentioned that too. These statistics are absolutely staggering. Equity in healthcare through Medicare for All would be a giant step forward in achieving simple human dignity and an opportunity to thrive for every single population and every single demographic. I'm very fortunate. I have had healthcare and good health, but I know so many stories like the ones I've just heard. You could also think about healthcare this way, that keeping people, that poor health, for example, untreated conditions that can be treated but are not being treated are a huge detriment. It keeps people from thriving, and it's a huge waste of human potential. So I'm pleased asking the senator, let's fix this. Let's fix it with Medicare for All. Thank you.
Thank you, Lisa. Next up is Tawfik Muadah.
Thank you, Gina. My name is Tawfik Muadah. I'm a board member of Working Families Party in Washington State, Martin Luther King County. I live in South King County, where many immigrants and people of color forced south by rising rents and gentrification. The pandemic has hit our communities very hard, and things were hard to begin with. Healthcare should be provided to all and should be a human right. The Medicare for All plan is what is needed. While our nation spends billions on military, South King County has huge groups of people who do not have health insurance. Many of our community members, particularly in Sate and Tequila area, worked at the airport. Many have lost their jobs. Some of them still do work there, but cannot afford the health insurance. The data collected by King County shows that our communities of color are hit harder by COVID. There are higher rates of hospitalizations and deaths. According to a King County report, almost 15% of folks living in Sate and Tukwila area do not have health insurance. North Highline has almost 18% uninsured. Kent has about 12.2% uninsured. Seattle, on the other hand, has about 3.6 uninsured. Fremont area, for example. The Sate-Tukwila area has about 35% of people at below the 200% federal poverty level. This is outrageous and totally unacceptable. Let me give you an example of an airline catering worker living in Sate. He has this story. The cost to insure our family is over $500 a month, and price increase every year. But the coverage seems to get worse. I have received surprise bills in the mail from doctor's visits to treat my 10-year-old son's diabetes. And we have even had to reuse insulin needles because it's hard to afford the supplies. I have to get my surgery because of nerve damage in my hands from work. The surgery is going to cost $2,000 out of pocket, and I make $15 an hour. I have 3 kids, and my husband is on disability. This is very, a story that many workers has. With rising rents and majority tenants in our communities, we have been hit hard. For example, in SeaTac, 41% of our households spend more than a third of their income on rent. People of color much more likely to pay more than 33% of their income on rent. We need a policy to ensure health care for all that's affordable and accessible for all. Medicare for all makes sense. This is outrageous. It's ironic how the richest country in the world can afford over $650 billion for defense budget every single year. However, we're having problems getting basic human rights, that is healthcare. Thank you for listening.
Thank you, Tawfik. So that is the end of our second group of speakers. We have one more group. We're going to pause here. Thomas, did you have any questions or concerns you want to address from any of these speakers?
No, again, no specific questions. I guess I will just say I appreciate the feedback that I'm receiving from you all, and I think one of the things, again, as somebody coming from a public health background, one of the things that we've really seen from the pandemic is these different health disparities are really being highlighted and being brought to the forefront of the discussion in health. And many of us who have been around public health for a long time are kind of screaming from the rooftops, like, finally, like, what do you mean that we're just now starting to realize that all of these things are tied together? So I think coming out of this, it's definitely going to be added into the discussion and help move that needle along. So I appreciate kind of hearing again from the folks on the ground. So thanks for that.
Wonderful. Thank you for that comment. I appreciate you stating that. Next up, is Larry Cole on the line?
He surely is. Thanks,
Hi,
Gina.
Larry.
Howdy. My name is Larry Cole. I'm with North Seattle Progressives. I'm a retired licensed mental health counselor, specializing in older adults and the disabled, working in community mental health for a number of years. I've witnessed chronically mentally ill people live better and longer lives with mental health help. News reports recently cite research showing the pandemic has caused big increases in depression and anxiety, and tragically, thoughts of suicide. Medicare for All can help in several ways, Thomas. First, until now, the federal government leaves mental health insurance requirements to states. There are big differences state to state. In some states, insurance for counseling is minimal or non-existent. Secondly, even within a state, there are differences. In these healthcare deserts, there are few counselors and even fewer psychiatrists and PhDs. My brother, for example, lives 2 hours from the nearest mental health provider on some pretty bad roads. Medicare for All broadens the definition of who qualifies for insurance payments to include licensed mental health counselors like myself and licensed marriage and family therapists. And finally, the Office of Health Equity, created by Medicare for All, will improve tracking mental health care outcomes. Last year shows us that there are big differences, and we need better data to evaluate outcomes. We can track if Medicare for All helps us, for example, build back better. Thanks again, Thomas, for listening.
Thank you, Larry. Next up, my friend Kelly Powers.
Thank you, Gina. I also want to thank you, Thomas. I know you hear a lot of these stories and we're piling it on, but they're just never ending and we just have to fix it. So I'm Kelly Powers. I'm an exchange consumer since 2012 and a member of Healthcare as a Human Right. And I'm sharing this message, Thomas, I'm hoping you'll channel this for me to Senator Cantwell, woman to woman, because healthcare is a paramount issue, particularly for women. Women in our society, especially women of color, earn far less than men. Women care for children and elders and volunteer in our communities. There are times in our lives when women are invisible, unpaid, essential workers. Several of my friends juggle 2 jobs, their full-time job and their unpaid part-time job caregiving. It would be a huge relief for them to scale back their work hours. What holds them back? Healthcare, health insurance specifically. As older adults, they know they can't afford ACA health insurance. Our family alone has spent over $100,000 on ACA premiums alone since 2012. In addition, relying on partners for healthcare can create a dangerous vulnerability for women. During the 2008 recession, a friend stayed with her husband only because she had a medical condition and relied upon his health insurance. History will not have a favorable view of putting women in that position. So decoupling healthcare from employment is as critical to women as childcare assistance. I urge Senator Cantwell to sign on and champion Medicare for All when reintroduced in the Senate. Thank you.
Thank you, Kelly. Next up, oh, we're in for a surprise. Joelle Croft.
I apologize because I'm in the middle of doing mutual aid as somebody who's houseless. And the reason I'm houseless has to do with insurance, actually. My quick story is I've lived in Washington State my whole life. In 1994, I was the youngest in Washington State to be diagnosed with multiple sclerosis. I was 16. I was lucky because my father worked for the government, the IRS, so I had great insurance. And then my jobs always got me insurance, or my previous husband. Well, because my insurance was tied to my husband, I literally stayed in a horrible marriage for 2 extra years. Plus I've staved off cancer things, and I already had my uterus out because of cancer issues, because I can't afford it. And I stayed in that marriage because I was terrified to lose that insurance. And of course, what happened when I lost that insurance? I was lucky because I was already fast-tracked on disability, and I was before I had gotten divorced. But the hard part about that was that meant that all my medication costs just went through the roof, because as we know, Medicaid, Medicare cannot negotiate drug prices. So my drug prices went up almost, I want to say 2,000%. I would pay like normally $3 or nothing, and now I'm paying 60 to 80 to 100 and some dollars. As someone on disability, I don't have that extra money. And I stayed in a horrible relationship to do that. I have been houseless since I got out of that relationship because I only make $800 on disability. And as we know, no one can survive on that in Seattle, no matter where you are. And I am lucky that I have people who help me get my medications and food and stuff like that, so I'm not dying, which is why I do mutual aid as much as I can and when I can, so that other people aren't suffering because they don't have heat or water. And it really ties to our health and our insurance. And because insurance is tied to jobs, which is what I had before until I got married, and then because of the recession and because of babies, I wasn't working at the end, and because of my disability, I can't work at all. And I would be a powerhouse if I did, but I am spending so much time dealing with insurance and stuff like that, that literally one of my medications costs $14,000 every 6 weeks. $14,000. And luckily Medicare pays some, but there's $1,000 that I had to come up with figuring out how to get that cost paid for. Every 6 weeks I have to deal with that. And I can tell you, in any disease, but especially in multiple sclerosis, stress is the worst thing. And it's literally killing me. And as someone who a lot of people in this society knows, I do anything and I can for the people of this society. Why are we continuing to literally let people die because we want to give more money to insurance companies? This is beyond the time. We're past the time. Gina's daughter is past the time. She's already not here. You're showing us day in and day out, when we don't do this, that literally it's okay for people to die. That's me. That's me. You're saying this, and we can't do that anymore. We just can't. I am 43 years old and I love this state and I want to stay and contribute and do more for this society, but I can't if I literally am being killed because policies would rather not give health insurance to everyone, when we can do it. Every industrialized country has done it. There's no reason to say we can't, besides it's just money for someone else. So please, this is beyond the time. We are past the time, and it's now. This is the time when we need to show that we can do this, and to show people like me that we actually say and do what we continue to say we do when we are running for office. This is beyond the time. Thank you so much for coming here, for inviting me to speak, and everyone who has spoke before me. I'm proud to be with all of you. Thank you.
Thank you, Joelle. And I just want to mention really quickly, Joelle is the powerhouse from Washington Community Action Network. She's a member leader. And Thomas, if you can hear me right now, I just want to say Joelle is the epitome of why I asked that question I asked earlier. How do you put a dollar bill on the life of a human being? That's exactly why. So let's go on to Claude Burfect.
I'm Claude Burfect, and I am the first vice president of the Seattle-Kane County NAACP. Today I am here basically just advocating for the seniors in the state of Washington. And I just want to say 95% of our seniors in the state of Washington are paying more than $5,000 per year out of pocket on medical expenses. I pretty much have a question as to, can you explain Medicare with a supplemental plan and the significance of a qualified zip code, which means there's only, it states that you have to be in a certain zip code in order to be able to receive these benefits. So I was just wondering, can that be explained? Maybe not today, but sometime maybe you guys can explain why is it that only a certain zip code you will be able to be qualified for certain benefits on this Medicare supplemental plan. That's it.
Thank you, Claude.
So I do not have an answer for that right now, but I'm happy to do a little bit of digging and see what we can find.
Because one of the things is that, you know, here we are with all of these deductibles. You have the deductibles and co-pays that could be covered by this Medicare supplemental plan, but it's only certain individuals. Why can't it be for everybody, but it says certain individuals and certain zip code areas that would qualify for this. So my question would be, could you answer that zip code question? And why can't it be for everybody? The supplemental plan be for everybody.
Yeah.
Okay, so we have one last speaker, Jim Howe.
Hi, I'm Jim Howe. I'm the VP for Legislative Affairs at AFT Washington and liaison to the healthcare as a human right. I'm diabetic, but generally in good health. I've been receiving Medicare since retiring as the faculty president at LW Tech. The last time I saw the senator, I introduced her at a commencement ceremony a few years ago at LW Tech, Lake Washington Institute of Technology. AFT, who I represent here, represents higher ed faculty and staff, healthcare educators, paraeducators, and K-12 essential workers. And we've learned the meaning of essential workers over the past year. So what do I have to do with healthcare? We can negotiate wonderful benefits for our full-time members and colleagues, but layoffs and reduced hours for part-time workers mean they lose healthcare. And the majority of them are people of color. Furloughs mean they struggle to make copays. There are Band-Aids like temporarily providing expensive COBRA, but that not everyone qualifies for that, and the system is broken for many. Congresswoman Jayapal points out in just the first months of this pandemic, 5.4 million people lost their health care. That was the highest increase in uninsured Americans ever. These workers are the poster children for the failure of an employer-based healthcare system. If you still have qualms about Medicare for all being a radical idea, please check the polls. 69% in these times is clearly mainstream America. Healthcare is a human right. So here as a labor rep, I'm happy to share this message from the Washington State Labor Council President Larry Brown. I'm sorry I could not join this call today. The WSLC has stood for healthcare as a right for many years, both for union members and their families, and for all people in our state and nation. At each of our state conventions since 2017, we have adopted resolutions endorsing Medicare for all. COVID-19 has driven home more than ever that we need to take healthcare off the bargaining table. We urgently need a national solution that guarantees affordable and equitable healthcare to everyone, regardless of employment status. Thank you very much.
Thanks, Jim. That concludes our list of speakers for today. Thomas, did you have any questions or concerns that you want to bring up now?
No specific questions on my end. Just thank you all for taking the time to just share your stories with me. And like I said, it's always great to be able to be connected to you all. And as things start moving this Congress and we start looking at these different proposals, it's helpful to have folks that we can come back to with the questions when they come up. So thank you for making this connection.
Sure. We have just like 2 or 3 extra minutes, so I just want to kind of dig in here for myself. One of the things that HCHR is doing with this new year in policy is that we are digging more intently into the fact that Black, Brown, Indigenous communities all kind of take a harder hit than anybody else. They are the most vulnerable. Many of the stories that you heard today touch on that. And I would like for you to take just a minute to tell us what you hear from Senator Cantwell about what direction she's hoping in terms of the BIPOC community in healthcare going forward.
Yeah, thanks for that. I would agree. I would say that that's really something that, like I said before, that the pandemic has really highlighted is these disparities that we've seen in the different communities. And I'll say not just Senator Cantwell, but the Democratic caucus at large and the other members of the Senate Finance Committee have really been actively raising the question about what are we doing about these different health disparities and how are we addressing health inequities. Again, that those of us who have been around public health for a little while have seen and observed and have really wanted to look at and figure out the right ways to make these kind of connections. And a lot of that starts with the community engagement and not taking a model and forcing it into a community, but really going to that community and having a discussion. And I think it's a breath of fresh air with the new administration, seeing that they're really taking both science and data seriously and utilizing that to both highlight the inequities that we've seen, but then also try to strategize and in real time come up with different solutions, such as, take the vaccine rollout as an example. They've seen that we're missing different communities, specifically communities of color. So where are those individuals more likely to congregate? Can we partner with faith-based communities to administer vaccines and to have those types of discussions? Can we partner with other community centers or the community health clinics that are maybe a little more accessible and in different areas, instead of just saying, well, we're only going to partner with the large hospital chains? So I'd say that it's something that, again, it's a breath of fresh air to see, and it'll take, again, continuing the conversations with folks like you to see all of this play out as we move forward, and to continue to put the pressure on those who are really making these decisions to ensure that the voices of everyone being included.
Thank you for that. Well, I just want to take a moment to say that HCHR really does have a huge following of members who would love to share their stories and help Senator Cantwell and any other of the senators who might need their stories to help in that end, so that we can make sure that communities of color, disability community, all the communities, everyone, because frankly, we all are really in need of healthcare right now. That being said, I do have two quick questions before we close out this meeting. I would like to ask, number one, can we count on Senator Cantwell to lead on delivering health justice in 2021 by guaranteeing equitable health care for all people in our country? And if so, how? And then the second question is, we would love nothing more than to meet with Senator Cantwell herself to discuss further how we can work together with her to deliver health justice in support of her.
Yeah, thank you so much for that. I would say, yes, the senator is dedicated to increasing healthcare access. If you asked her what is the number one issue right now is improving access to healthcare, and she will be continuing to focus on that. I think she wants to ensure that we're utilizing the best proposal possible that is available. And again, she has been a longtime champion of the basic health plan as an option through the Affordable Care Act. That is kind of everybody has a little bit of skin in the game, but it really addresses those high premium costs that you mentioned, and hits at the group of individuals that's really being missed. And we've seen from the American Rescue Plan, that the government is willing to prioritize and look and acknowledge that group by kind of giving some of these temporary subsidies, right, on those purchasing through the marketplace, but that there should be other options available. So, and as far as setting up a meeting, you know, it's so tough. The senator's schedule is just so incredibly packed right now, with her taking over as chair of the Commerce Committee this Congress. That has really been taking up a lot of her time, but I am happy to take the request to our scheduler and see if that's a possibility that we could set up a time for you all to talk.
Anytime in April would be wonderful, or the first week of May would be great if that's possible. And I just want a little clarification. When you say that the senator is working on improving healthcare access, is she being intentional about getting stories and being vocal about the communities of color in her scope of improving healthcare access?
Yeah, that's a good point. I mean, I think at this point we're not collecting stories specifically. I think it's having informational meetings like this for me as staff to get a better sense. I can't speak for the senator and, you know, who she's speaking to when she's back home, or the conversations that she's having, but it's very helpful to have like I said, the connection with you and being able to collect those stories when the timing is right, and that's what we're searching for.
Thank you. So that concludes our portion of the meeting. If you have anything else you want us to know, or if anyone on this call has any very quick comments they want to make to Thomas, please do that now so we can wrap up.
Can I make a comment?
Sure.
I want to understand, or it's kind of a comment question. I want to understand the term healthcare access better, because if there's a Tesla dealership down at the U Village, so theoretically I have access to a Tesla, but I can't really buy a Tesla. So that word kind of hangs me up a little bit. Could you talk to me about that some more?
I mean, we're right at the bottom of the hour. I'm going to have to hop to another meeting. I'm happy to follow up with you all if you have any other that I can write in writing. I would say real quickly, access is something that we have looked at in great detail. And again, one of the things, just pointing to an example with the vaccine rollout, it's great that you've set up mass vaccination sites in Washington State. But one thing that my boss was concerned about was, well, what about the people who can't navigate the websites and go through that type of technology and need assistance to get that? Well, part of ensuring that people have access is setting aside appointments for those who make those calls and need to go through the system that way. So it's not just, like you said, it's not just about plopping it down, but it's ensuring that there's the pathways and the systems are set in place. And a lot of that is going to take innovative solutions and coordination kind of across the different sectors. But I do have to hop to another meeting, so I apologize, but happy to set up another time and answer any other questions.
Thank you very much.
Great. Thank you.
Bye.